मैं ठीक हूँ, आप कैसे सर?
बस बढ़िया। आपने कोविड में भी आईएपी दिल्ली को खूब अच्छा संभाल रखा है।
ये पूरे इस जो पिलर्स हैं खड़े हुए हैं वहीं पे आपके, डॉक्टर दिनेश, एवरीबॉडी, डॉक्टर शालिनी,
नहीं अच्छा कर रहा
हम
है।
लोग का पूरे ब्रांच, सिटी ब्रांचेस, दे ऑल देयर,
ऑल ऑफ देम डूइंग वेरी गुड जॉब। मैंने अगले 2 हफ्ते पॉइजनिंग ही चलनी है लगता है।
मैंने तो अभी फर्स्ट हैंड एक्सपीरियंस किया, वही दिनेश को बता रही थी, हाइपोक्लोराइड सोल्यूशन मेरे इन्वर्टर की बैटरी में चला गया और पूरा घर फ्यूम से भर गया, और माय फादर इन लॉ हैड ड्रॉप इन सैचुरेशन, ये अस्थमैटिक, तो ये had acute exacerbation. So it's so important to read the wrapper. Whatever written over there, this is so important.
Yeah, Dr. Nab is joining very soon.
ये 2 मिनट में हम स्टार्ट कर ही देते हैं।
ये लोग हैं, देखें अभी
12-13
लोग, 12-13 तो आए गए हैं।
हाँ जी, 14 पीपल आते हैं। अभी 2 मिनट हैं।
डॉक्टर शालिनी 1 आवर का करना है तो 40 मिनट 50 मिनट्स
एज पर सर आप जितना भी
आप
टाइम
जैसा कन्वीनियंट लगे आपको सर।
जब तक लोग हैं जब तक करते रहें, जब कहेंगे बोर हो गया तो बंद कर देंगे।
सर नहीं, आपकी टॉक कभी बोरिंग होती नहीं सर।
बोरिंग भी नहीं होती है सर, टॉपिक भी इंटरेस्टिंग है। मैं तो मतलब आई वाज वेटिंग सिंस लॉन्ग पॉइजनिंग का कराने के लिए। हम लोग तो काफी दिन से वेट कर रहे थे, डॉक्टर दिनेश एंड मी।
हम तो सर आपसे कई सारे कराने वाले हैं अभी, मेरे तो दिमाग में कई सारे।
It's my pleasure to be associated with all of you. तो नेशनल मीटिंग, आपकी एनुअल मीटिंग भी ऑनलाइन ही करनी पड़ेगी आपको फिर तो।
हाँ शायद ये नॉर्थ पेडिकॉन तो कर रहे हैं ना सर, 30 जून 30 इससे, और ये वेब वीक्स बना रहे हैं।
अच्छा,
आई थिंक आपको इन्फॉर्मेशन होगी। 30 से 5 सितंबर तक 1 वीक का वो बना रहे हैं।
बट काफी इवन इंटरनेशनल कॉन्फ्रेंसेस में मैं देख रहा था, they are doing online platform only with a proper everything. Even they are charging for attending this online conferences.
We did hematocon sir on the charging basis. तो वो भी हमारी 5 days की थी कॉन्फ्रेंस।
नमस्कार।
हाँ जी, गुड आफ्टरनून।
हेलो सर, गुड आफ्टरनून।
गुड आफ्टरनून दिनेश, क्या हाल चाल?
सर बढ़िया सर, गुड आफ्टरनून सर।
आप छुपे वो नजर नहीं आ रहे, बस आवाज तो आपकी आ रही है।
नहीं, मैं तो, मुझे आप
सर दिख गए।
अच्छा,
आई कैन सी यू।
करें शुरू सर?
या
3 बजे
कर दें?
हाँ डॉक्टर।
या ओके, sorry. Yeah, good afternoon everyone. Now we are again here for our weekly meetings, and this time we are here with a very interesting topic, which is we have Dr. Suresh Gupta with us. He is a senior consultant at Sir Gangaram Hospital, and I think sir, this is one of your favorite topic, and very interesting lectures always. I have already attended few talks in PCNI and other conferences also. And this is our today's topic is on prescription drug poisoning and common management of these poisonings. So Dr. Dinesh, over to you. Would you like to say something?
Good afternoon. First of all, happy Janmashtami to all of you. And I'm really sorry कि हम फेस्टिवल पे टॉपिक रखे हैं, but I think it will interest you, and Dr. Suresh is the expert in this. I welcome Dr. Suresh Gupta sir for this topic. Thank you.
Thank you, Dr. Dinesh. and Dr. Shalini, Dr. Nab, President IAP Delhi, and Dr. Smita, Secretary IAP Delhi, they are also there, and their presence in itself speak of that IAP Delhi North Zone is doing a very good job. Yeah, both of them are there to support that. The topic for today is prescription drug poisoning. When it comes to poisoning, particularly in children, most of the pediatrician, when they handle these kids, they feel okay, most likely कुछ होगा नहीं इस बच्चे को, right? But at the back of mind, it's always there that कुछ होना चाहिए. So that fear is also there. And I will say both these mental events which are happening in pediatrician mind are absolute true. Why I say these are true? Because 80 to 90% of poisoning in children, whether it's a household poisoning or prescription drug poisoning, are benign and trivial. But 10% of kids do land in problem. And that is our concern. We don't want to miss any child who is going to land up in problem because of toxicity and have some morbidity and mortality. And this is the concern of most of the pediatricians. As far as poisonings are concerned in children, at least in city of Delhi, we see two categories of poisoning. One is household item poisoning, and the other is prescription drug poisoning. Common medicine which are lying in home, they get consumed accidentally, some time even suicidal by the children. And how we handle these kids. The first topic on household item poisoning, this will be doing, that topic will be doing, I think next week on 20th of August with Dr. Nab and IAP Delhi.
Yes.
Right? And this part of prescription drug, which is another common problem in children, we are doing this time. So going on to the topic directly. When we say prescription drug, it means the drugs which are available on the prescription of the doctor only, right? And rest of the drugs are OTC drugs. But as far as India is concerned, there is nothing like prescription drug. All drugs are OTC drug. You can get anti-cancer drug, anti-psychotic drug. Just call your chemist nearby and we'll be very happy to deliver you at your home without any prescription with 10% discount. Is that true, Dr. Naab?
Yes, 10-15%, just
discount,
to people.
And even without asking any prescription. So for us, all the drugs are OTC drugs, practically speaking. There are few terms or terminology which are often used interchangeably, right? But the meaning is different. Side effects, overdose, toxicity, and poisoning. Side effects are the effect which occur with a therapeutic dose. Toxicity and poisoning you can use interchangeably, but the meaning may be a little different with both of them. But on practical basis, I think both are same. Overdose, when we say is that you little exceeded the dose of the medicine, and the therapeutic effects are little more exceeded and side effects are little more exceeded. And you can see this famous personality. You know what is common about them? Is it going to be interactive, Dr. Shalini? Because I can't hear the sound of the...
Yes, sir. In the end of this session, we will take question and answers, sir.
You're not going to make interactive in between?
Not now, sir.
No, you want to leave it one-sided only.
Dr. Dinesh, please.
We can go by chat, sir, actually.
Okay. So you can see this famous personality exactly. On the topmost is left side Socrates and Chanakya, then all of you know this lady, young lady, and I think most of the young boys, at least of my age, when they were there, they used to have her picture in their rooms, at least in hostel room. And on the right side, there are two latest famous personality. What is common among about all this personality is that all of them died because of poisoning, and many of them died because of prescription drug poisoning, including Hitler. So poisoning is not limited to only children or poor men. They are equally common even in affluent and high profile society. So how do you approach a child in which case you are suspecting a poisoning? First and foremost thing is always initial stabilization, GI decontamination. And if you don't know what kind of poisoning it is, you can use the toxidrome approach, use antidote, and there is a poison information center at All India Institute of Medical Sciences. You can call that center anytime 24/7, and most of the time they are able to provide reasonably good information regarding the poisoning, and those services are working very well. But remember, as far as antidotes are concerned, only there are 20 antidotes which are available. In last 20 years, no antidote has been added to the list. So most of the poisoning, whether it's a children or adult, will be managing without antidote. Fortunately, even in absence of any specific antidote, most of these children can be managed and stabilized and saved with simple supportive treatment. So this slide is again emphasizing all those points which were discussed in the last slide. Let us take few cases and then we'll have a feel of what the poisoning is. This is a 2-year-old boy brought in by the neighbor after grandmother states the child is not acting right. Grandmother thinks he might have ingested some of her medication. This is a concern of the grandmother. Both the parents are working, they are away. So only grandmother is there in the emergency room with the child and with the neighbor. When you assess this child looks little more sleepy. There are no physical finding except the pupils are very small, 1 to 2 millimeter size. On vital examination, child got heart rate of 70, which is little lower for this age. Respiration is okay. BP is 80, systolic, palpable method. Temperature is normal, and weight of the child is 13 kg. Will you say this child is poisoned? And if you say it is yes, what kind of poisoning it can be?
I think those who want to answer can raise the hand and we will take on the panel.
Can I see those hands?
They have not raised the hand.
Achha,
Anybody
okay. But
I
can see it actually on my screen also.
Yes, you can see.
Just let me.
To all participants, please raise the hand
Because
if you want to answer.
I have to go to the chat part to see.
So chat part also, and if they can raise the hand,
Achha, I will get the symbol of
Yes.
Okay. So anyway, everybody is in a festival mode today. They want to be more like a passive listener. Even that is a good idea. So we'll say yes, this child may have a poisoning. Reason being, this child got a sudden onset of symptoms. Any child got sudden onset of symptom, particularly if it is unexplained by any other illness and multi-system involvement, then you always think of poisoning. What kind of poisoning it is? We don't know, right? grandmother is taking some medication, but she has not brought down any of those medications. Let us try to analyze this child and come to conclusion. In a child with poisoning, history is very, very important. Time of ingestion, amount of ingestion, and
Hello.
hello.
Dr. Suresh.
Hanji sir.
To see you. What is the meaning of this triangle? Toxicology triangle?
This is not toxicology. This is initial assessment triangle
What is the
appearance, breathing, and circulation. This is a
breathing?
triangle.
ABC.
With ABC, you say.
Okay.
This is the initial assessment triangle,
Okay.
which we use for any child landing in emergency room.
Okay. I got it.
Right. It's not particularly to poison.
Mm-hmm.
Sometimes you may have to take the help of family and friends, which may act as a historian. And many times, many medicine are lying at home, right, which parents or family member may not have used for many, many months, and they are not even aware that those medicines are there. So asking the family to get all the medicine which are there at home, right, may be a good idea, so that you can keep a possibility, okay, what all things child may have consumed. The initial assessment of a child with poisoning, where you don't know what type of poisoning it is or which poisoning it is, using these 4 parameters: mental status, vital signs, pupillary sign, and skin sign. These 4 things. This is directed physical examination. And based on these parameter changes, you can make a diagnosis of a toxidrome. Okay, this can be this toxidrome, and these are the possibility of this toxidrome. These are the drugs or toxin which can cause this kind of toxidrome, and then you can sort out. As far as this vital signs are concerned, W generally will lie within normal limit, and WNL. But actual meaning of this WNL is we never look for. In any critically sick child, whether it's a poisoning or any other thing, the vital signs are changing very, very fast. So whatever has been there 1 hour back may have changed by now. If I don't know what was the vital signs 1 hour back, I cannot make a comparison whether heart rate has increased or decreased, BP has increased or decreased. So you always write vital signs in terms of like BP so much millimeter, systolic and diastolic, pulse rate so many beats per minute, temperature, breathing rate 20 per minute. You have to write exact value. Toxidrome identification is just like making any differential diagnosis, which include history, examination, and sometimes even labs are required. In this child, grandmother is on some cardiac drug. In examination finding, 2 most important findings are lethargy and pupils are small. So what are the cardiac drugs which can cause sleepiness along with small pupil? Lab parameters are all normal. So keeping these 2 things in mind, sleepiness, small pupil, and some cardiac drug, one most important thing which comes to our mind is clonidine. Clonidine toxicity is same like morphine. Morphine also causes sleepiness and lethargy and small pupil. And that also causes decreased heart rate like in this case. Even respiratory depression can occur and even hypotension can occur. So this mother was on clonidine as an hypertensive. It's a centrally acting antihypertensive drugs. This drugs is also used as a narcotic withdrawal, particularly in our ICU, in my ICU, we use this drug for narcotic withdrawal for those children who are on continuous IV infusion of morphine or fentanyl. This drug can cause low blood pressure, small pupil, and coma. Now the question comes, should I do a GI decontamination of this child? If yes, which method of GI decontamination should be used? As today you are not in a mode of discussing or answering or questioning, so I will direct go on to the answer.
If anyone want to answer, can raise the hands. I think Dr. Sunil has raised the hand. Dr. Sunil, yes. Dr. Sunil, yeah.
Yeah. Hello.
Hello.
Yes, sir.
Am I
Sunil
audible?
Gupta. Dr. Sunil Gupta, he is very, very close friend of me, my roommate, and he was very popular by the name of GTS in our college days.
Okay, thank you. Acha. Gastric lavage, you just showed. Gastric lavage is the answer.
Okay. So Dr. Sunil Gupta feels that a gastric lavage should be done in this case. Let us discuss this point in a very brief manner. In which cases we should do a gastric lavage or GI decontamination. The decision of doing GI decontamination is something like deciding about antibiotic in a child with fever. Any child who comes with fever, you don't give antibiotic to each and every child. You decide whether the child needs antibiotic or not. And then second, you decide that even if this child needs antibiotic, because of whatever reason, which antibiotic you are going to use. Same is here for GI decontamination. First question, we have to decide whether we should really do a GI decontamination in this child or not. A child who is arriving so late, after 2 hours or 3 hours, where symptoms are already developed, it means the toxin already absorbed. So GI decontamination is not going to help. Medicine or toxin has already entered the system. Another question which may come to your mind is कि अगर GI decontamination नहीं करेंगे तो medical legal problem तो नहीं आएगी? No, because whatever you are following is evidence-based medicine. Whatever I am talking today is very well documented in books, research, and literature. So there is no hassle of medical legal documentation. In fact, if you do it and some complication happens because of this GI decontamination, then we may be in trouble. Because as per literature, guidelines, and books, this is not indicated. And we have done that. EPICAC, that is inducing vomiting, is no more used anywhere in the world. It has got out of fashion. Gastric lavage, as far as concerned, it is rarely indicated in children. Why? Reason being, most of the poisoning children are trivial poisoning. Number two, doing a gastric lavage in a small child is very difficult. When I say gastric lavage, it means orogastric lavage, not nasogastric lavage. And what most of us do is, we take a nasogastric tube, put in the side of the nose of the child, right? Put some saline. Child is crying, mother is crying, some amount of bleeding occurs from the nose, and mother says कि डॉक्टर साहब छोड़ दो अभी तो निकाल दो जो होगा देखा जाएगा अभी नहीं कर. And even you are not able to take out anything. Actual orogastric lavage is a very thick tube. This tube is so big, 24 French, minimum size is 24 French. The pipe which you use for watering the plant, that is the minimum size which is to be used. And the size of nasogastric tube, largest nasogastric tube, is not even half of that. So this nasogastric tube is not meant for orogastric lavage. So there is no use of it. The thing which you can use is activated charcoal. Activated charcoal, powder form, it is not available. Tablet is available. Each tablet is 250 milligram. Dose is 1 to 2 gram per kg. If it is 20 kg child, it means at least 20 gram. 20 gram means how many tablets?
20 tablets.
No, madam.
No, 40 tablets.
80 tablets.
40. 250 grams, yes, sir.
Or 250 milligrams.
Yes.
So you have to take 80 tablets. You take 80 tablet, you crush that, you can mix that in saline or coke and make the child drink. If the child refuses to drink, in that case, you can take a small nasogastric tube and then inject this into the stomach with that nasogastric tube. So do not get scared by the number of charcoal tablet, 80 tablet. 4 tablets will not do anything. Here we are not doing a bowel preparation for abdominal X-ray. 4 tablet is for abdominal X-ray preparation, not for poisoning. So
Is it easily available?
Yeah.
yeah,
Yes, it
yeah,
is available.
It's available.
Yeah.
Sometimes supply is little intermittent actually. Cathartics, no role. Whole bowel irrigation has some role in some of the poisoning. I will come to that. Enhanced excretion means when the toxins go into the system, right? And now you want to make the excretion. But this enhanced excretion is used to be used under some specific circumstances for specific poisoning, not for each and every case. That will I come to cases where you are going to do. Right? So the lesson which you learned in last slide is gastric lavage is not indicated in 99% of children. I will tell you in last 3 years, in fact, more than 5 years, the total number of gastric lavage which is done in our emergency room is not more than 3 or 4 times in a referral institute. Let us take this case. This is a 3-year-old child who had consumed many tablets of altroxin. And mother has got the child to Dr. Shalini clinic because she was talking about this case few days back to me. This mother is on altroxin, and after 6 hours, child has come to emergency this office. Child is asymptomatic and playful. How would you manage this case? Any participant would like to discuss? Dr. Shalini can discuss this case.
So I had this patient during a lockdown period, sir. And the child was 1-year-old child, male child. And mother called up in the evening and child ingested tablet in the afternoon, sir. I think it was already 6 to 8 hours and child was all right, totally all right. He was playing well, he was eating well. Then I said, either if you want to come, you can come to emergency room. We'll see the child. But she was at that time, COVID was on peak, so she was not ready to come here. Then we had a video consultation. Basically, sir, it was as such, it was not indicated, but I will have a look to the child, and I had reassured that just wait for a few more hours. If there is any problem, then you come back. Kuch hua nahi. Ultimately, baby was all right. She called me up at the night. The child is all right. Should I come to hospital? Then I said, okay, then wait.
So question is, for how many hours should we wait for the toxic symptom to appear in this case?
So at least 24 hours.
Okay. So this is a very, very misconception that we wait for 24 hours in each and every case of poisoning. Like each fever is different, right? Some fever lasts for 3 days, some fever lasts for 10 days, some fever lasts for 20 days. Same way, each poisoning is different, right? पहले हमारा फार्माकोलॉजी का जब एग्जाम होता था, साइड इफेक्ट आते थे, तो 6-7 साइड इफेक्ट हम सबके लिखते थे, जब हो या ना हो, नॉजिया, वॉमिटिंग, एब्डोमिनल पेन, तो सबका, इवन ऑन्डम में भी लिख देते थे. इज दैट ट्रू? राइट. सो सेम इज ट्रू ओवर हेयर. Symptoms and the likely toxicity when it's going to appear is very, very different in each and every case. This is a very typical example of that case, actually. In any poisoning, first of all, we have to determine how much tablet the child has consumed and what was the strength of those tablets. Like in this case, the mother has got this bottle. How will you define how much time? There were tablets lying on the floor. Mother is not sure how much he has consumed. Right? So what we do in this case is we ask, when did you bought this new bottle? When you started consuming this bottle? She says, okay, 10 days back. How many tablets she takes per day? She says 1 tablet per day. It means in last 10 days, she has consumed 10 tablets. So maximum tablets which are there in this bottle are 10 tablets. Now go on to the next step. How many tablets are still there? She says, okay, there are 70 tablets. Okay. And how much were there on the floor? She says, okay, there were 15 tablets. So 70 plus 15, it becomes 85. 10 she has already consumed. So maximum number of tablets which this child may have consumed is only 5 tablets. So for any toxin, this is the way we will calculate. We calculate not the minimum which the child has consumed. We presume what is the maximum dose which child may have consumed, because the toxicity is based on that. We want to take it on the higher side so that all the risk is included when you are assessing the child. So coming back to this case, for how long should we observe the child and what we should we do? Remember, this altoxin tablet is T4, it's not T3. T4 is an inactive compound, right? It doesn't cause any thyroid symptoms. It's only T3 which causes symptoms. So body has to convert this T4 into T3. Then the body will have some symptomatology. So body takes some time to convert this T4 into T3 after this drug has been absorbed. How much time it takes for the manifestation to occur? Let us go on to the next. Okay. Remember, most of the thyroid injections are benign. Usually, most of the time, manifestation will not occur for at least 7 to 10 days post injection. So rarely they will occur within as early as 3 hours. So first 2 days child is anyway going to remain asymptomatic. So nothing is to be done in first 2 or 3 days. Whatever is to be done, it is to be done after 3 days or 4 days. So what we do in this case is we ask the child and mother to relax for first 3 to 4 days, and then you ask them to come on daily basis for next 5 to 7 days or 10 days. See if the child is developing any symptoms or signs like tachycardia, right? That is the earliest symptom, or hyperpyrexia or restlessness. Will thyroid function test play a role if I do a thyroid function test after 24 to 48 hours? In this case, to see how much is the T4 level or T3 level, how much drug has really gone. 2 decades back, when I started discussing this thyroxine toxin, I used to say you do a T4 and T3 at 48 hours. If these are elevated, it means the child has ingested a significant amount. Then child has to be under constant observation, maybe on OPD basis. But in last 2 decades, the study has shown there is no correlation between the blood level of T4 and T3 and toxicity of L-toxin. So there is no point doing these levels. You have to monitor these children for 5 to 10 days at home only. There is no need to bring them to the hospital and get them admitted. Anytime they develop tachycardia or hyperpyrexia or too much of sweating, then sometime they need a hospitalization where they may need a sedation, cooling, and sometime local. I must have seen more than 50 cases of this thyroxine injection, and luckily nothing has happened. But one good tip for all the pediatricians: any injection less than 10 tablets of altroxin 100, that becomes 1,000 microgram, is benign. So up to 10 tablet, you can be very, very relaxed.
Irrespective of the age, sir.
Irrespective of the age. toxicity which is seen is generally seen about 5,000 microgram. 5,000 microgram, not at 1,000 microgram, right? These facts may be looking a little surprising to many of pediatricians because our knowledge of poisoning is still those of college days, right? And as a new literature, new studies are coming up, things are becoming more clear because there is no way we can conduct any study in poisoning. All these are based on a retrospective manner. As our understanding is improving, we are becoming a little more liberal. Let us take another case. It's a 5-year-old boy, difficulty in breathing, lethargy for 5 hours. Child looks lethargic with tachypnea and retraction. Child looks cyanosed. You examine, there is a tachycardia with normal CFT, mild tachypnea, BP normal, and pulse ox saturation is 85%, which is not improving on oxygen. Cardiovascular examination also normal. Chest is normal, and this is the blood gas. Anybody would like to say any diagnosis on this child? I think this is very, very obvious. ABG is brownish. Methemoglobinemia.
This is methemoglobinemia.
So a cyanosed child with normal cardiovascular examination with pulse ox 85%, no other diagnosis is methemoglobinemia.
Must have taken Dapsone.
Taken. Dr. Pankaj Garg is also there. Thank you so much, Dr. Pankaj.
Right. Thank you, sir. Very interesting talk. Continue, please.
Thank you so much. So cyanosis is not responding to oxygen, normal CVS examination, chocolate color, pulse ox shows normal SpO2, but the same PaO2 on Bulgarian 50, no. Methemoglobin level, right? These are some of the causes. Dapsone is one of the common drug. Mother is an anti-leprosy medicine. Treatment is mainly supportive, right? If it is just 10% or 20% methemoglobin level, you may not do anything. Just observe the child for 24-48 hours. Without antidote, they will be fine. But in the case you decide to give antidote, then 1 milligram per kg methylene blue. If IV is not available, even oral you can give. That is also very, very safe and effective. But the dose in case of oral route is double. That is 2 milligram per kg. 2-year-old girl brought to ED. The child is irritable and vomiting. Mother has given Calpol 7.5 ml 3 times since morning. No other medication. Injection occurred 3 hours before coming to ED. So how much paracetamol this child is ingested? This is 10 kg child. Right.
Calpol strength 240 or 120? Calpol comes in both the strengths.
Both the strengths. And so we have to ask which preparation, which concentration has been given actually. On prescription, this child was prescribed Calpol 120 of 7.5 ml. Right?
Nothing.
Right. But the chemist was very, very smart and very caring for this child, I must say. Instead of giving Calpol syrup, he has given Calpol drops.
Oh.
Oh my God.
Oh my God.
Now the question
so 3
is.
dose now the question.
Oh my God.
Right? This is the, in my practice, emergency practice, this is one of the commonest source of error where the chemist try to play very smart. I will give you more example. All the real cases actually. So this child consumes 7.5 ml. Calpol drops each ml, like during that time when this case happened, each ml used to have 150 milligram. Nowadays it goes 100 milligram. So 150 milligram per ml. So 7.5, 3 doses in 24 hours received. How much it has
1
gone?
gram.
Almost more than 1 gram it has
1
gone.
gram.
2 gram approximately. More than 2 gram it has gone.
15 7 is 105, no? So,
So 3 ग्राम चले गए इसके अंदर. 7.5 ml 3 times since morning has taken. So 3 gram of paracetamol has gone in this child since morning last 12 hours, right? During examination, this little child looks little anxious, small sweating is there. I don't know whether it's because of paracetamol or because of medicine per se. Child looks fine given 10 gram activated charcoal. My question is here, should I give an acetylcysteine to this child or not? You know, in India, paracetamol level is not available. Even if it is done, you'll get the report after 24 hours. But your decision is to be taken right now, right? 24-hour level is not going to take you help you the decision. All the rheumatoid method chart are based on paracetamol level report available within half an hour to 1 hour. So forget about paracetamol level, whatever. We have to manage these children on clinical basis. So let us decide about this child. Should I give N-acetylcysteine or not? Any volunteer? How will you decide? Should I wait for the liver function test done and then decide?
So I think we should give.
We should give. Okay. Any other volunteer? Dr. Shalini is absolutely right. We should give. Right? Why it is so? If paracetamol levels are not available, any dose above 150 milligram per kg should be considered toxic. Though children can tolerate up to 200 milligram per kg, children can tolerate paracetamol much better than adults, right? Because of younger liver. But above 150 in children, I give it. Most of the children will be asymptomatic for first 24 hours, remember, in paracetamol. If you do a liver function test during this time, all that will be normal, right? But this is the best time when your N-acetylcysteine is going to work. It should be given within 8 hours of ingestion of paracetamol. Then the results are best. If you delay it after 24 hours, then results are not very, very good. You have crossed that window. So we have to give paracetamol when the child is asymptomatic. So I always base my decision regarding N-acetylcysteine on the total calculated doses.
150 milligram in 24 hours, sir.
150 milligram per kg in 24 hours. 200 milligram, you can take 200 milligram if it is staggered dose like in this case. If it is single dose, then 150 milligram. It all depends whether it's a staggered dose or is a single dose. In single dose, you can wait even up to 200 milligram. If it is in scattered dose. If it is single dose, 150 milligram per kg is sufficient. Right? As I told you that initially child got very, very weak symptom, right? They will not have any problem. And all these symptoms, nausea, malaise, this can occur because of the underlying viral fever or this thing, very difficult to make out. In second 24 hours, then the enzyme starts elevating. It means the liver injury has already started. And if you have not started the N-acetylcysteine during first 12 hours or 8 hours, it means you have missed that important window. So decision here is regarding N-acetylcysteine. Best you can read. I will not go into detail of each and every poisoning. What I'm going to do in my presentation is give you those tips actually, which are specific to each and every poison. Like in thyroxine, I told for how long you observe and where you observe and when you start the observation. But here the decision is regarding antidote, when it should be given. So all the poisoning, I have taken those kind of tips which are in decision-making format. Dose you can go through. I just leave it actually. Let us take more cases. 2-year-old boy with 1 episode of vomiting and seizure. Child has got some itchy skin condition for which some liquid medication are prescribed. Grandmother is given 1 teaspoonful 3 times a day, and last dose received 3 hours back. You think this can be some poisoning? Anyone? Okay. Examination, child is normal, vital sign is normal. What is the most like offending agent and how this child should be managed? In this child has scabies, and the doctor has advised gamma benzene hexachloride to be applied locally on the skin, and grandmother could not understand the instructions. So instead of applying locally, she has given it 3 times a day by mouth, and this gamma benzene hexachloride toxicity. So Indian poisoning are little different actually. The way they occur is different. The circumstances where they occur is different. If you read this Western book, they will not give you this kind of scenario because their setup is totally different. So this was a gamma benzene hexachloride poisoning, accidental poisoning. What are the other drugs which can cause itching? But they can also cause seizure if given inappropriately, in inappropriate route or inappropriate doses. The other is antihistaminics, which are used for itching. They can also cause seizure if very high dose is given. And pyrethroid, permite lotion, which is applied locally again for the scabies. Even that can cause seizures. So this I have discussed. Most of the children will have just single episode, right? Right. What you have to do is just anticonvulsant, a brief anticonvulsant like benzodiazepine. If the child remains asymptomatic and no seizure occurred, even 12 hours of observation is more than sufficient in such children. You don't have to admit them for 24 hours. We'll talk about this organochlorine poisoning more in our IAP daily discussion. So this is another girl who is 12-year-old, right? And she was recovering from chicken pox. And because of itching, she was prescribed some medication. And she is brought to emergency room because she was behaving little abnormally, little agitated. When you examine her, her pupils were dilated and reacting. Fundal examination was normal, there was no edema. In vital signs, there was tachycardia with normal BP, with normal respiratory rate, but the child is febrile. Skin was dry and flushed, which is not normal. So is the intoxidome present over here? I think everybody can make out this is anticholinergic, datura kind of poisoning, right? Typical datura, that mnemonic which you remember. Warm, dry, flushed skin, dry mouth, mydriasis, tachycardia, illness. But why we are discussing over here? This is a prescription drug lecture, because there are prescription drugs which can cause datura-like syndrome. And the common drugs which can cause datura-like syndrome is AAA, you can remember. Antihistaminic, antipsychotic, antispasmodic, muscle relaxant, and antidepressant, tricyclic antidepressant. So these are the drugs which have got an anticholinergic symptom and can have a datura-like presentation. Here I'd like to share one more case in the same, just like this kerosene or paracetamol poisoning. This child has some abdominal pain. I think 2-year-old child. Again was prescribed syrup Colimax, 5 ml 3 times. Each 5 ml has got 5 milligrams, right? And then I received a call maybe around 10 p.m. Okay, doctor, my child is jumping in the bed, 3-year-old child. और वो कह रहा है मेरे को सांप नजर आ रहे हैं. So I asked him what medication I give. written prescription. This is Colimax दिया था डॉक्टर साहब आपने तो. I asked the dose, how much you given? They said 5 ml 3 times since morning. I told them, okay, you tell me, you just bring that bottle and read what is written on that bottle. And then they read out Colimax drops they have given, 5 ml 3 times. Each ml of Colimax drop has got 10 milligram. So 5 ml becomes 50 milligram. The dose which has to be given was 5 milligram. So 10 times the dose a child has received. Antispasmodic. And that's why this child was developed datura-like symptoms, was having hallucinations, delirium kind of presentation. And again, it was a very, very smart chemist was trying to be very friendly with the family. Tell them कि छोटा बच्चा है, सिरप के बदले ड्रॉप्स दे दो, ज़्यादा अच्छा रहेगा. So this is a very, very common confusion between syrup and drops. What is to be done in such cases? Most of the time, if there is no respiratory depression or child is not coma, they will settle down of their own. But if the child got unstable vital signs or in coma, then physostigmine is the antidote. 5-year-old boy brought by the teacher from school having nausea, vomiting, bloody diarrhea. Patient said that he ate some of her mother prenatal vitamins before breakfast and now he is feeling little sick. So I think family planning program is not working properly. That's why mothers are still having so many children. The bottle of the mother, which was having 30 tablets of ferrous sulfate, is now empty. So this is, maybe this child is a good iron poisoning. When you talk about iron poisoning, you don't see just the quantity which the child has consumed. You look at how much is the concentration of elemental iron in that preparation. Take example of tonoferon syrup. In tonoferon, there are 3 things. Tonoferon syrup, which is adult, tonoferon pediatric, and tonoferon drops, right? If the child, 1-year-old child is given 5 ml of tonoferon syrup, right? So 25 milligram per kg. 2 चम्मच उसको मिल गया तो severe toxic can happen. But if you talk about Dexo range, वो पूरी बोतल भी पी जाएगा ना 7 मिलीग्राम पर केजी, तो उसकी आयरन डेफिशिएंसी भी ठीक नहीं होगी. So look at what is the concentration of iron in that product. There is so much variable concentration in iron. So you have to calculate what is the total elemental iron. Most of the children who are having less than 15-20 milligram per dose will remain asymptomatic. About 20, definitely you have to be very, very careful. Above 40 can be toxic, potentially serious, and above 60, even mortality can happen. When we talk about poisoning, we always write symptom में क्या है जी, nausea, vomiting, सब में ही होता है. But in case of iron poisoning, iron ingestion, vomiting is a very, very specific symptom. If the child doesn't develop vomiting within 6 hours of ingestion of iron, it means there is no iron toxicity. It is such a specific symptom. All children with significant iron ingestion will definitely develop vomiting within first 4 to 6 hours. If this is not there, you can almost, it may not be always because there are always exceptions. In most of the cases, no iron poisoning. These are different stages, local stage and then systemic stage. The book writes all these stages, but most of the children will not follow these stages of the book because they have never read these toxicological books. They behave totally different. Each child behaves totally different. Okay? Some children have more local symptom, not systemic symptom. Some children have very minimal local symptom like 5-6 episodes of vomiting and then directly end up into shock. Regarding management, all symptomatic patients, irrespective of the level of the iron, serum iron, should be treated with desferoxamine. If the child is asymptomatic, right, you can do abdominal exograph to see if the child is ingested tablet, how many tablets are there. Again, this is also misconception कि आयरन टैबलेट खाई हैं तो एक्सरे में नजर आएंगी जरूर. It is not true, right? Many studies have appeared in the literature in last 1 decade where they found the iron tablets are visible on plain X-ray only in 30% of cases. In 60% of cases, iron tablets were not visible on plain X-ray. It all depends on which salt of iron it is, how much is the iron content of the tablet. So don't believe abdominal X-ray to calculate the number of tablet of iron ingested. Serum iron level useful if it is more than 400, right, and asymptomatic, child can go home. If it is more than 400, even if the child is asymptomatic, they should be treated. These are gross guidelines. 500, 400 milligram is not a very strict this thing. 400 1 है तो देना, 400 नीचे है तो नहीं देना. They are general guidelines. Treatment, GI decontamination. This is one situation where you should remember that whole bowel irrigation should be done, right? This, which is particular to children. Again, in whole bowel irrigation, don't use Lexopeg. Lexopeg is different from Peglac. The name of the salt is same, polyethylene glycol, but molecular weight which is there in the Peglac is different from Lexopeg. For whole bowel irrigation, we use Peglac, not Lexopeg. Remember this. Right? Let us take some antipsychotic drugs. Right? There are a number of antipsychotic drugs which are available because most of us not treating this psychotic patients. All these names may appear little odd to us, but any medicine has this Dawn, Pine, Rip, Pip, right? These are the newer antipsychotic drugs. First generation, second generation. Most of the time, the people are nowadays using newer generation or second generation or atypical because the side effect of these drugs are little less as compared to first generation. Adverse effect. Here I'm talking about adverse effect. The first generation, more neurological symptom. Second generation, the latest one which are used nowadays. Neurological symptoms are not much, but metabolic side effects are. As you can see here, abdominal girth increasing, they start gaining weight, body edema increases, right? And even hyperglycemia. So these are regarding therapeutic dosage side effects. Here, let us go on to the toxicity. What will happen? Two main effects which occur with antipsychotic drugs is depressed mental status and cardiovascular effect in terms of hypertension and sometimes anticholinergic. Any child who got antipsychotic injection, no, the newer one, most important parameter to monitor, even if the child is asymptomatic, is monitor them for QT prolongation. For how long you monitor? There is no need to monitor in asymptomatic child for more than 6 to 8 hours. 6 hours is more than sufficient. If you want, you can extend it 8 hours. The QT prolongation doesn't occur and child doesn't develop any symptom, you can safely send these children home. If they develop any symptoms or QT prolongation occur, then there are no specific treatment which are available like soda bicarb, physiostigmine, even IV lipid emulsion are given, were used in one case. And sedative hypnotics, right? There are many classes of sedative hypnotics, and the sedation, hypnosis, general anesthesia, they are basically continuation of the same spectrum. Classification, barbiturate and non-barbiturate. most of the time what we'll see is benzodiazepine drug. Okay? Primary manifestation, CNS depression, but most of the time they are very, very safe drug. Even in very large doses, except for sedation, nothing happens. I have not seen any children dying because of hypnotic sedative poison, except one thing, which pediatrician has to be very careful. Chloral hydrate or pedicloral. All pediatricians are very fond of using this thing, this chloral hydrate. It's a very, very notorious drug and very bad drug, let me tell you. I have seen many cases, not single case, many cases. They use it for sedation during procedure. ठीक है, बच्चा रो रहा है, सीटी स्कैन के लिए क्लोरल हाइड्रेट। जब सीटी स्कैन करता है, जब तो बच्चा रोता रहता है, जब सीटी स्कैन हो जाता है फिर वो 24 घंटे के लिए सोता है। So it has its effect when the procedure is over. So from my point of view, it is a useless drug. And many times what happens, this radiology people, एक डोज से नहीं सोया, रो रहा है ज़्यादा, 2 डोज देंगे, 3 डोज देंगे, 4 डोज देंगे, नहीं रोया, थोड़ा सा मिडाजोलम लगा देंगे, सीटी स्कैन तो हो जाएगा, but they have their peak effect later on. In my emergency room, I have seen 3 children landing in the middle of the night after CT scan with respiratory depression, cyanosis, landed in ICU. Chloral hydrate is a notorious for cardiac arrhythmia. So don't take this drug very lightly. Never use it on OPD basis. कई बार बच्चा रोता है, रात को माँ का फ़ोन आता है कि बच्चा रो रहा है, सो नहीं रहा है, हम कहते हैं पेडिक्लोरिल पिला दो जी, ठीक है, right? So never prescribed on home basis this drug. Okay? Complication may not occur 1000 times, but it can occur in next episode, and we don't want that.
I think now it's not available in the market.
Pedicloral available. Okay? Identification of the drug is not really important for initial management in ER, and because the initial management remains for all the same thing, except for phenobarbital, where knowing yes it was phenobarbital is important, because अगर phenobarbital पता लग जाता तो ऐसे बच्चे को alkalinization of urine can help in excreting the drug initially. Otherwise, it doesn't matter which drug it is, which sedative it is, treatment remains more or less same. Right, Saru 4 o'clock, I will just take 5 or 10 minutes more and then finish it. 4-year-old child consumed 4 tablets. Father has been taking this drug last 4 months. Right? ये कोरोना के बाद ही बेचारा father depressed हो गया क्योंकि काम पे जा नहीं पा रहा था, and the whole day he was to see only one face, you know which face, right? And all of us were also getting depressed because same face we were seeing the whole day. Right? Many of my colleagues may feel a little disturbed, but sorry, I'm for that. Right, so this is the drug which citalopram. What is this drug? This is one of the commonest used antidepressant medicine. ये हमने MBBS के टाइम एटलीस्ट मेरी जनरेशन ने तो नहीं पढ़ी थी, क्योंकि नहीं आती थी, है ना? एंड पीडियाट्रिशियन जनरली एंटी डिप्रेसेंट यूज नहीं करते, समटाइम वी आर नॉट श्योर व्हाट ग्रुप ऑफ दिस ड्रग इज, राइट? सो दिस फॉल्स इनटू सेरोटोनिन रीअपटेक इनहिबिटर. It is one of the atypical antidepressant. Usually it's not life-threatening, but monitoring all children for 24 hours is important even for these cases. Here 24-hour monitoring is important. And which monitoring you'll do? We have to do ECG monitoring, repeated ECG for QTG prolongation, right? And second thing which can happen is seizure. So don't take this drug lightly, particularly in small children. And if very high dose is taken, then serotonin syndrome can happen. You know the symptom of serotonin syndrome, right? Like diarrhea, vomiting, sweating, all those things can happen. So this child monitored in PICU, remained asymptomatic, and at 10 hours you can see that QT prolongation is happening, but child remain hemodynamically stable. Child given IV soda bicarb to maintain the pH between 7.4 to 7.5, and child discharge after 48 hours. So that was one of the antidepressants. These are the other antidepressants. I will not go into details. The one of the other largest group of antidepressant is cyclic antidepressant. Cyclic antidepressant. इसके अंदर एक ये स्केल हम यूज़ करते हैं एंटी डिप्रेसेंट ओवरडोज रिस्क असेसमेंट पे, ED अडोरा करके, विद इन फर्स्ट 6 आवर. अगर विद इन फर्स्ट 6 आवर QRS इज मोर देन दिस और अल्टर्ड सेंसोरियम या अरिथमिया या सीजर ये कुछ हो जाता है, तो इसका मतलब दिस इज ए वेरी वेरी बैड सिचुएशन. दिस चाइल्ड इज गोइंग टू हैव ए बैड टाइम इन नेक्स्ट 1 week. The second group is asymptomatic children, है ना. अगर persistent tachycardia है and QT prolongation, even if the child is asymptomatic, 24-hour monitoring is needed. Okay. So cyclic antidepressant, all patients should be observed for minimum 6 hours. अगर SSRI है तो 24-hour monitoring. अगर cyclic antidepressant है तो 6 hour monitoring is sufficient. Again, toxicity same CNS and cardiovascular. एक ये जो मैं पर्टिकुलर चीज़ बोलूँगा, दो आई विल नॉट से दिस इज ए पॉइजनिंग, ना, दिस इज ए काइंड ऑफ idiosyncratic reaction which can happen to anybody. Can you see this child? This is ACEI, basically induced angioneurotic angioedema. Yeah? AC inhibit like NVAS and all those kind of drugs. They can cause by particular mechanisms angioedema. Remember, this reaction is not immune mediated, IgA mediated or complement mediated. Many times these children can develop airway obstruction because of tongue edema. They are not going to respond to either adrenaline, hydrocortisone or antihistamine. Right? In fact, they may create more problem. So treatment is only supportive. Treatment is only supportive. Generally take 48 hours to settle down, right? And for lifelong, they cannot use this drug. This can happen even with a single dose. This is the last case I will take, then finish. Right? 1.5-year-old child ingested 1 tablet of glipizide, brought to ER after 1 hour. Right? What are the repercussions in this case and how will you manage this child? What is glipizide?
Anti-diabetic.
Anti-diabetic drug. Which group of anti-diabetic? MBBS टाइम में हमने 2 ही ग्रुप पढ़े थे, एक सल्फोनिल यूरिया एंड दूसरा बाइगोनाइड्स. स्टिल थिंग्स रिमेन सेम, है ना, क्योंकि हम लोग एंटी डायबिटिक ड्रग्स यूज़ नहीं करते, तो इसलिए नाम में हमको ध्यान नहीं रहता ये सल्फोनिल यूरिया है कि बाइगोनाइड्स. एक ही ड्रग है बाइगोनाइड्स में, मेटफॉर्मिन. बाकी सारी ड्रग्स को सल्फोनिल यूरिया की तरह ट्रीट कर लो, खत्म बात. इफ इट इज नॉट मेटफॉर्मिन, ट्रीट देम लाइक सल्फोनिल यूरिया ड्रग. इसमें करना क्या है, ठीक है. मेटफॉर्मिन के अंदर अगर हाइपोग्लाइसीमिया होता है, that will happen within first 6 hours, and metabolic acidosis, 2 ही चीज़ें होती हैं उसके अंदर. अगर 6 घंटे के अंदर बच्चा एसिम्प्टोमेटिक है, ब्लड शुगर मेंटेन है, ब्लड गैस ठीक है, safely can go. But metformin is relatively safe drug. But this sulfonylurea drug, which are one of the commonly used oral anti-diabetic drugs, a single pill can kill an infant. Remember, these are one of the tablet where 1 pill can kill. एक use करते हैं mnemonic. I will tell you in during IAP, 1 pill can kill. What are the drugs where single pill can kill the drug? This is one of the drugs, right? Sulfonylurea. Effect of sulfonylurea as far as hypoglycemia is concerned can last minimum for 24 hours. I'm telling you, minimum for 24 hours, depending on the dose. So even if the children are asymptomatic, 24-hour observation in hospital observation is important, and monitor their blood sugar repeatedly. Second, if they develop hypoglycemia, right, are we going to start dextrose drip, continuous dextrose drip? No. You treat hypoglycemia with bolus of dextrose, but don't start dextrose. एपिसोड को ठीक करो और साथ में ओरल फीड इसको देते रहो, राइट. ड्रिप इसलिए अवॉइड करनी है बिकॉज डेक्सट्रोज ड्रिप will further increase stimulation of insulin secretion. This group of drug acts by increasing insulin secretion, right? जो metformin है उसका different mechanism. This is the problem with drug. कि insulin secretion को increase करती है, तो इसलिए कभी भी continuous prophylactic dextrose drip नहीं देनी. If you give the continuous prophylactic dextrose drip to these children, the chances of hypoglycemia are much higher. So treat each episode of hypoglycemia, continue oral feeding. In case hypoglycemia is not getting corrected, even in them, the option with us is octreotide. There is no other option. Octreotide and second dioxide. Dioxide generally we avoid in children because of risk of hypertension. So I'll finish here only because the time allotted to me was only 1 hour. I have taken 1 hour 10 minutes. Sorry, Dr. Shalini, that I have taken 1 hour 10 minutes, and I will finish here on. Thank you so much. I hope everyone knows this Poison Information Center number. If you want, I can just give you the number. You know the Poison Information Center number?
No, sir.
I don't
know.
मैं भी भूल जाता हूँ, इसलिए मैंने अपना स्टोर करके रखा हुआ है. I'll just tell you. In the meantime, we can take some question if somebody wants.
Yes.
Dr. Veena want to ask him. Sir, it is 1800-116-117.
हाँ, ठीक. Number is very easy. 116-117. Right. 1800 is the toll-free number for any toll-free number. तो 116-117 ये याद रखने का. What is the question from Dr. Veena?
Dr. Veena, you are there?
Hello.
हाँ, Dr. Veena.
Yeah. Good evening, sir. It has been a very comprehensive talk. Just wanted to ask, long back we had been using burnt bread also instead of charcoal tablets, because many times they're not available. Hello?
Can you just repeat that? Voice is not clear.
Ma'am, sir, ma'am is saying that can we use the burnt bread, jala hua bread instead of charcoal?
अच्छा. The charcoal and burnt bread is different. देखो, when we use a charcoal, we always say activated charcoal. It's not a passive charcoal.
Okay.
है ना? Active charcoal is basically जो normal charcoal को activate करते हैं जब activated होता है, right? तो this burnt bread is a useless actually. There is no point giving because that is not activated. It will not absorb anything. 1 gram activated charcoal का surface area जितना होता है, it's more than 500 square meter. इतना होता है.
Oh, okay, yeah.
है ना? बर्न इतना सरफेस, अगर उसको अलग अलग सेपरेट उसके सारे मॉलिक्यूल करें तो इतना एरिया बन जाता है उसका.
Okay, thank you, sir. Thank you, sir.
Dr. Suresh?
Dr. Suresh.
Giving charcoal is also a cumbersome process.
Yes.
In sedative child.
Charcoal is a definitely cumbersome process, but एक चीज इसके अंदर है कि like we should keep the charcoal tablet in our office practice itself. क्योंकि by the time बच्चा emergency room पहुंचता है या hospital पहुंचता है, that window period is lost. तो बेटर होता है कि चारकोल टैबलेट क्रश करके हम क्लिनिक में उसको दे दें तो बड़ा अच्छा रहेगा.
ओरली दे दें फटाफट.
ओरली दें. हाँ.
और should be kept in the emergency room also.
हाँ, it should be there in the
हाँ,
of course it should be there in the emergency room, but अगर इसको before we send the child to the emergency room, many times children land up in our office practice directly.
Okay.
और कहते हैं जी घर से हम सामान लेके जाएंगे, ये लेके जाएंगे, वो विंडो पीरियड निकल जाता है.
You give me some address or some address of chemist shop where we can find it easily.
मैं बता दूँ, I'll find out and let you. जहाँ हमारे यहाँ कहाँ से.
Great. Okay.
Any more question you want to ask? Please raise your hands. Anyone?
And I am preparing a book on poisoning in children, which may be available by end of this year actually. And all this issue, common issue, will be dealt there. That may be a good reference for all of you.
Yes.
Shobna want to ask
Suresh, why?
Hello.
Hello.
Hi.
Sir, I want.
Ms. Gupta, are you in favor of making these gummies, vitamins in the form of gummies, which most of the companies they are coming out and they are telling it's it can be swallowed very easily. Children like it. Sometimes there can be overuse of those gummies. That can also be. I think it should be avoided as far as I think. Gummies, uses of gummies. Yeah. And given to children and not keeping them out of reach.
Yeah, this is an issue. This OTC drug is an issue all over the world, right? Companies keep on pushing through one way or the other way, but even water-soluble vitamin, right? There, not all water-soluble vitamins are absolutely safe. They say कि water-soluble इससे तो कुछ नहीं होगा. This is not true. Particularly these 3 water-soluble vitamin, which can be toxic, and if taken very large, one is pyridoxine, the other is vitamin C. अभी तो आजकल डेली विटामिन सी खा रहे हैं, मुझको मालूम नहीं कभी कोई 50 टैबलेट खा के आएगा तो क्या होगा, है ना? ठीक है. And niacin. These are the 3 water-soluble vitamin, though they can be very toxic actually. And what this fat-soluble vitamin, that they can be toxic. We've seen many cases of vitamin A toxicity and vitamin D toxicity.
So any toxicity to this CADA and all those?
CADA toxicity जो मैंने देखी है लोगों के अंदर, many of the patients were coming to कि गला मेरा ठीक नहीं हो रहा, because during
burning
corona season, many of us, so they took anti-allergic, they were not getting cured. Then I asked them what, कहते हम तो काढ़ा पीते हैं. मैंने कैसे पीते? कहते जी खूब गाढ़ा करके काढ़ा पीते हैं, है ना? वो उसको इतना concentrate करके पी रहे थे, that itself was causing irritation. So I told them stop that thing, and they were okay within 5-6 days. तो इंडिया में होता कि more strong होना चाहिए, है ना? वो कर करके many of them were developing acidity, gastritis and this thing. जिसका मैंने बंद किया सारे ठीक हो गए.
काढ़ा पीने से सबसे लोगों का पेट में दर्द हुआ है मैक्सिमम. हाँ,
गैस्ट्राइटिस बहुत
गैस्ट्राइटिस.
वो क्योंकि they were making it too concentrated. Yes. It has to be something like green tea. जैसे green tea में पानी का ही टेस्ट आता है, ठीक है तो टेस्ट आता नहीं. You should be so light.
Dr. Shobna, you want to ask something?
Sir, about the vitamins, like also comes many children, they take folic acid who are on anti-seizure drugs. Sometimes the younger sibling take. So other folic acid is harmful, ना?
3 मैंने वाटर सोल्यूबल जो विटामिन में मैंने बताया 3 विटामिन हैं जो मेन कर सकते हैं. एक तो पायरोडॉक्सिन, दूसरा नाइसिन और तीसरा ये कौन सा बताया था मैंने? विटामिन सी. These are the drugs which can create problem.
And my question is about all out. Many patients, children, they come. It's very common. They की all out.
इसका अगर मैं आंसर आज दूंगा ना मैम तो डॉक्टर नाभ मेरे से नाराज. मैंने क्योंकि कहेंगे डिस्क्लोज कर दिया आपने मेरा पहला ही पेपर.
सर one question I want to ask.
तो मैं इसलिए नहीं बता रहा कि डॉक्टर नाभ नाराज ना हो, और दूसरा इसलिए भी नहीं बता रहा ताकि नेक्स्ट वाले प्रेजेंटेशन में भी आप हो IIT दिल्ली वाले के अंदर.
Okay, sir. So one question I want to ask. So another common poisoning I used to get is phenytoin sodium. मतलब like इसकी टॉक्सिसिटी से बहुत कॉमन है, मतलब बहुत बच्चे आते हैं सर.
हाँ, इसको इसलिए नहीं डाला क्योंकि थोड़ा टाइम का इशू था, पर इसका मैं बता देता हूँ बिकॉज देयर आर सर्टेन इशू विद दिस एंटी कन्वल्सेंट पॉइजनिंग. ठीक है ना. एंटी कन्वल्सेंट में यही मेन है जो सबसे ज़्यादा ये करती है प्रॉब्लम, एंड क्लोरप्रोमेजिन करती है प्रॉब्लम, एंड वेल्प्रोइक एसिड. 3 ड्रग हैं जो एंटी कन्वल्सेंट प्रॉब्लम करती हैं, बाकी काफ़ी सेफ है. फेनेटाइन के अंदर जो एक मेन इशू आता है कि यस इन 15 मिलीग्राम पर केजी की बात नहीं कर रहा मैं, ड्रग लेवल के. इनिशियली मेन होता है निस्टैग्मस, राइट. फर्स्ट सिम्टम इज रिलेटेड टू द आई, माइल्डर. लेवल ज़्यादा जाते हैं तो उनकी चाल में फर्क आ जाएगा.
अटैक्सिया वेरी कॉमन प्रेजेंटेशन.
थर्ड, अगर लेवल पे चले जाएंगे तो सेंट्रल सिम्टम आ जाएंगे, स्पीच स्लर्ड हो जाएगी एंड दे कैन लैंड, है ना दी. तो पहले आंखें गई, फिर चाल गई, फिर दिमाग गया. इस तरीके से कर सकते हैं. इसके अंदर एक बात याद रखने की मेन ये है कि इसकी जो टॉक्सिसिटी है ना थोड़ी डिफरेंट है एज कम्पेयर टू अदर. इसके टॉक्सिक सिम्टम, ऑल दिस इफेक्ट may not disappear in after stopping the drug even for up to 3 weeks. So you have to tell to the parent कि जो इसको अटैक्सिया हो रहा है, स्लर्ड स्पीच हो रही है, is going to persist. It may persist even up to 3 weeks. नहीं तो वो क्या आपके ऊपर कूदता रहेगा कि डॉक्टर साहब तो कहते तो ठीक हो जाएगा, बंद कर दिए दवाई, अभी तो ऐसे ही हो रहा है. रीजन इज कि इसकी फार्माकाइनेटिक्स ऐसी है ना. अभी फार्माकाइनेटिक्स हम सब लोग भूल गए हैं, है ना. 0 ऑर्डर काइनेटिक्स, फर्स्ट ऑर्डर काइनेटिक्स, है ना. जस्ट एक ब्रीफ में एक ही लाइन बताऊंगा, ज़्यादा नहीं बताऊंगा. फर्स्ट ऑर्डर काइनेटिक्स में क्या होता है कि जैसे ड्रग लेवल बढ़ता जाता है, एक्सक्रीशन बढ़ता जाता है ना. तो लेवल ज़्यादा हुआ, ज़्यादा एक्सक्रीट हो गई तो जल्दी जल्दी ड्रग स्पीड हो जाएगी. पर इसका एक्सक्रीशन थोड़ा डिफरेंट है. इसका एक्सक्रीशन ड्रग क्या है कि जब तक थेराप्यूटिक लेवल में है, फर्स्ट ऑर्डर होता है. एक बार टॉक्सिक लेवल पे चला जाता है, 0 ऑर्डर बन जाता है. 0 ऑर्डर का मतलब है कि वो फिक्स अमाउंट ऑफ ड्रग्स विल बी एक्सक्रीटेड पर डे. फिक्स ड्रग, उससे ज़्यादा एक्सक्रीट ही नहीं होनी. तो उसके सिम्टम चलते रहेंगे जब तक इसकी लेवल है, तो धीरे थोड़े करके निकलेगी. तो इसलिए सिम्टम इसके लंबे चलते हैं. एक चीज़ इसमें हेल्प कर सकती है, एक्टिवेटेड चारकोल, मल्टीपल डोज एक्टिवेटेड चारकोल, है ना. ये एक्सक्रीशन का मेथड है, इसमें अब्जॉर्प्शन की बात नहीं कर रहे, एक्सक्रीशन के पार्ट ऑफ द ड्रग इज एक्सक्रीटेड इन द ड्रग इन द गट. तो इसमें क्या है कि डेली उसको 1-2 चारकोल टैबलेट देते हो. जो गट से रीअब्जॉर्ब हो रही है ना एक्सक्रीशन से, तो रीअब्जॉर्ब नहीं होगी वो, तो उसको हफ्ते तक देते रहो बेशक. तो मल्टीपल डोज एक्टिवेटेड चारकोल बोलते हैं इसको. सो इट्स ए वे ऑफ फर्दर इंक्रीज द एक्सक्रीशन ऑफ ड्रग.
यस,
ड्यूरेशन याद रखना बस इसका कि 3 हफ्ते तक इसके सिम्टम चल सकते हैं.
यस.
डॉक्टर Bineet, you want to ask? Dr. Bineet, you are there?
Dr.
Bineet Kumar. Dr. Bineet Kumar, you are there. Please unmute yourself and ask your question.
Sir, my SGOT raised after taking Giloy for 2 months.
After taking?
Giloy.
अच्छा, गिलोय.
Yeah.
हाँ, इसका गिलोय जो टॉक्सिसिटी है, क्योंकि प्रिस्क्रिप्शन ड्रग में नहीं आते तो मैंने लिखी नहीं किसी को आज तक. तो इसके बारे में आई डोंट हैव मच नॉलेज वेदर दिस गिलोय रिलेटेड और समथिंग. आई एम नॉट श्योर अबाउट इट कि गिलोय से क्या टॉक्सिसिटी हो सकती है. बट इफ यू टोल्ड मी, आई विल वर्क ऑन दिस, एंड जो IAP वाला अपना जो प्रेजेंटेशन होगा, आई विल इंक्लूड इन दैट.
थैंक यू सो मच सर.
तो काढ़ा टॉक्सिसिटी भी हो सकती है.
काढ़ा
ठीक है, जैसे पहले अब गिलोय टॉक्सिसिटी, काढ़ा टॉक्सिसिटी यही आएंगी आगे.
हाँ, ये हो सकता है. जब होगी, जब पता लगे, जब कोई भी चीज की टॉक्सिसिटी का जब भी पता लगता है जब खाना स्टार्ट करते हैं उसको.
वन ओल्ड लेडी, ग्रैंड मदर ऑफ चाइल्ड, वो बच्चा कह रहा है जी हमारी लगातार काढ़ा पिला रहे हैं सुबह शाम, मेरी दादी के तब से दर्द शुरू हो गई पेट में. मैंने कहा ये काढ़ा की वजह से बंद करो, ठीक हो गई.
हाँ, लोकल इरिटेशन तो बहुत ज्यादा हो रही है उसकी वजह से.
Dr. PEWS, Please unmute yourself and please identify yourself also, sir.
ये ड्रग है कोई?
नहीं, ये नाम है वो शायद।
वैसे हमारे हिसाब से PEWS का मतलब पता क्या होता है? पीडियाट्रिक अर्ली वार्निंग स्कोर।
ये MBBS में बताते हैं।
हाँ, PUS।
Sir, please identify yourself because you are not repeating your name.
I'm audible?
Yeah,
Yes,
you
yes.
are there.
I'm Dr. Bharat Bhushan.
Okay, yeah.
हाँ डॉक्टर भरत, जानता हूँ मैं आपको बिल्कुल।
हाँ जी सर, गुड इवनिंग सर। सर एक 1 ईयर चाइल्ड गैस्ट्रोएंटराइटिस का इरिटेबल था, उसको 1.5 ml हमने फिनार्गन के लिए बोला एंड सिस्टर अनफॉर्चुनेटली गिवन IV फिनार्गन। हेलो?
हाँ हाँ
yeah, you're there.
After that child was very irritable and उसने he started climbing. So what should we do? मतलब what should be the management part? Climbing and irritable, throwing मतलब tonic posturing and starting.
एक्स्ट्रा
हाँ देखो, जो फिनार्गन है दो हम इसको एज ए एंटीहिस्टामिनिक यूज करते हैं, है ना, बट एक्चुअली बेसिकली दिस ड्रग वाज डिजाइंड फॉर एज ए एंटीसाइकोटिक ड्रग। दिस इज ए फर्स्ट जनरेशन एंटीसाइकोटिक ड्रग है, एंड फर्स्ट जनरेशन एंटीसाइकोटिक ड्रग आपने मेरा प्रिस्क्रिप्शन वो स्लाइड में देखा होगा, एंटीकोलिनर्जिक सिम्टम होते हैं इनके।
जी जी
देखा था ना, AAA मैंने बताया था, एंटी साइकोटिक, एंटी डिप्रेशन, दिस थिंग। तो दिस बिकॉज ऑफ दिस एंटी कोलिनर्जिक इफेक्ट ऑफ दिस ड्रग they develop dhatura kind of symptoms actually. So that was the reason the child was getting all this so what should be the treatment का स्पोर्टिव है, खाली स्पोर्टिव। अगर रेस्पिरेटरी डिप्रेशन हो रहा है और बच्चा कोमा में जा रहा है तो फाइजोस्टिग्मिन इज द एंटीडोट फॉर एंटीकोलिनर्जिक इफेक्ट।
Otherwise he was okay after 3 hours.
हाँ मोस्टली, अगर वो सिम्टम नहीं है, हाँ कार्डियोवास्कुलर सिम्टम नहीं है, कोमा नहीं है, फिर कुछ नहीं करना।
Okay, thank you sir, thank you.
There is one more question, sir.
Dr. Suresh, do you prescribe any book related to toxicology?
हाँ,
we are waiting for such book.
मैं अपनी बुक ही आपको सजेस्ट करूंगा, उससे उसकी सेल बढ़ेगी। इसलिए मैं अभी बता नहीं रहा दूसरी, क्योंकि दूसरी खरीद लोगे तो मेरी नहीं खरीदोगे।
नहीं ठीक है
सॉरी, बट देयर आर लॉट्स ऑफ बुक एक्चुअली ऑन टॉक्सिकोलॉजी। जितनी भी पर बुक डिजाइन की गई है ना, मैंने देख रहा था,
वो इंडियन के हिसाब से नहीं है।
नहीं, वो बहुत मोटी है, टॉक्सिकोलॉजी पॉइंट ऑफ व्यू से बनाई गई हैं वो सारी, टॉक्सिकोलॉजिस्ट के पॉइंट ऑफ व्यू से।
ओके
रन इन थाउजेंड ऑफ पेजेस एक्चुअली। तो जो मैंने समरी आपको निकाल के दिया ना, एक टिप मिल जाए मैंने करना है कि नहीं करना फ्रॉम पीडियाट्रिशियन पॉइंट ऑफ व्यू, वो नहीं देते, वो ढूंढने में ना बड़ा टाइम लगता है, उसके अंदर आपको 20 पेज पढ़ने पड़ेंगे।
वी कैन वेट यार, नो प्रॉब्लम,
है ना। तो मैं वो बुक है, एक गोल्ड फ्रैंक टॉक्सिकोलॉजी बुक है, ठीक है ना। जो
ये गंगाराम वालों ने क्यों नहीं ये अपना हेल्पलाइन स्टार्ट किया?
ये फ्री का काम है ना।
नहीं तो फ्री का काम में तो गंगाराम चैंपियन है।
मैं इसमें क्या है,
नहीं इससे पता क्या होता है, इससे डायरेक्ट टच में आ जाते हैं, क्योंकि ऑल इंडिया ना एक गैप है, एक गैप है माइंड में। गंगाराम इज वेरी नियर टू आवर पेडियाट्रिशियन।
नहीं वो मैं बात मान रहा हूँ डॉक्टर साहब। चक्कर क्या है कि रनिंग ए पॉइजन कंट्रोल सेंटर इज ए वेरी एक्सपेंसिव अफेयर, इट्स नॉट ए चीप एक्सपेंस। दो यू मैं फील कि एक फोन करके बताना ही तो है। You need a round the clock trained person, round the clock trained person who can give appropriate information from the database, है ना। And the salary of such a person in All India Institute of Medical Sciences is 1 lakh per month. Minimum you have to give 4 people.
You can नहीं, you can take the charges also. हाँ, charge भी कर सकते हो।
हाँ वही, तो ये थोड़ा एक्सपेंसिव है कि मोस्ट ऑफ द ऑल ओवर द वर्ल्ड, वैसे मैं बता रहा हूँ ये फ्री सर्विस है एक्चुअली, इवन इन यूएस दिस थिंग पेड कहीं पे नहीं है, कहीं चली नहीं, कॉस्ट इफेक्टिव बनी नहीं कहीं पे।
ओके
पर ऑलरेडी इंस्टीट्यूट वाले आराम से इंफॉर्मेशन देते हैं, कोई दिक्कत नहीं होती।
नहीं देते,
आई हैव यूज्ड इट मेनी टाइम्स।
मतलब समटाइम मैनेजमेंट अगर मैनेज करना हो तो अकॉर्डिंग टू मतलब जो भी हेल्प,
नो सर दे गाइड यू अप, दे
गाइड तो कर देते हैं, गाइड तो कर देते हैं,
बहुत अच्छा गाइड करते हैं।
बाकी मैं तो हुई ना
सर। तो फिर
पर थायरॉक्सिन के बारे में ये गाइड सही नहीं हुआ, ये आज मैंने पहली बार बड़ा अच्छी तरह डॉक्टर सुरेश गुप्ता ने एक्सप्लेन किया। तो थायरॉक्सिन के बारे में तो बहुत मिसनोमर है मार्केट में। इवन गायनेकोलॉजिस्ट जो भी आते हैं वो फटाफट 48 आवर्स में या तो ऑब्जर्व करते हैं या भेज देते घर। और जब तो ये प्रॉब्लम स्टार्ट होती है आफ्टर 3
उसके
डेज।
तो ये क्योंकि
10 टैबलेट से ज्यादा तो कोई लेता नहीं।
मोस्टली क्या है कि मोस्ट ऑफ द टाइम पीपल थिंक कि पॉइजनिंग एक ऐसी चीज है 24 घंटे बच्चा ठीक है तो ठीक रहेगा।
हाँ
नहीं, ऐसा नहीं है जी। आई
ये
विल कम
बहुत
टू दिस
आज
पॉइंट। मैं आपको जब डॉक्टर नाब वाला प्रेजेंटेशन में आऊँगा तो उसमें पता लगेगा हाउस होल्ड पॉइजनिंग कितनी वेरी करती हैं। व्हाट इज द
वो
क्रिटिकल
स्लाइड तो
पीरियड
तुमने आज आउट कर दी।
व्हाट इज द
स्लाइड तो
क्रिटिकल
आउट कर
पीरियड
दिया
फॉर
है।
ऑब्जर्वेशन। कुछ हैं जिनको 48 आवर्स के बाद ही एडमिट करने का फायदा, उससे पहले एडमिट करने का फायदा ही नहीं है। जब आप डिस्चार्ज कर रहे हो, इनफैक्ट वो एडमिशन का टाइम है उसका।
हाँ, ये बड़ा मतलब सरप्राइजिंग कमेंट थे आज।
हाँ, तो क्योंकि हम सब लोग कोई भी नहीं पढ़ता पॉइजनिंग बेसिकली।
हाँ
Sir, and last question is, any contraindication for the charcoal tablet?
Yes, there are contraindications for the charcoal tablet. The contraindication, one of the biggest contraindication is अगर intestinal obstruction है तो कभी नहीं दे सकते। Severe constipation उसको नहीं दे सकते, है ना। Being charcoal itself is constipating, है ना। Constipation not absolute contraindication, but it can create a problem unless उस साथ में आप laxative ना दो। एक तो ये है। दूसरा, टॉक्सिटी पॉइंट ऑफ व्यू से कॉन्ट्राइंडिकेशन इसकी है पर्टिकुलरली अनकॉन्शियस चाइल्ड। अनकॉन्शियस चाइल्ड में अगर आपने उसको दिया विदाउट सिक्योरिंग एयर वे, है ना, खाली नेजो के अनकॉन्शियस बच्चे आपने नेजो गैस्ट्रिक ट्यूब से दिया उसका और बाई चांस लंग्स में चला गया, लंग्स कैन नॉट क्लियर इट एंड चाइल्ड विल लाइफ लॉन्ग डैमेज टू द लंग, एस्पिरेशन, निमोनिया। एक तो ये इशू है। दूसरा, some of the toxins are not absorbed, though they may not be considered as absolute contraindication, but it's not useful for them. Like hydrocarbon poisoning है, हमारा हाइड्रो केरोसिन पी के आ गया, है ना, तो उसमें नहीं होगा। काफ़ी सारी मेटल्स हैं, उनमें नहीं यूज होगा। पर जितने प्रिस्क्रिप्शन ड्रग्स हैं उनके लिए तो सबके लिए यूज़ कर सकते हैं, प्रोवाइडेड दे लैंड अप विद इन 1 or 2 hours.
So with this, we are closing this session, and I want some final comments from Dr. Nab and Dr. Smita ma'am.
Thank you very much, Dr. Suresh Gupta. It was a wonderful discussion, and 3-4 new things which we have understood. One, we talked about recently about thyroxine part, the thyroxine toxicity, and even regarding water-soluble vitamins, you said. So normally we take, whenever a large amount of vital water-soluble vitamins are taken, they will be passed off. So we have to be careful about it. We have to be extremely careful whenever someone has taken any excessive dose or dose which was prescribed by doctor but given differently by the chemist. We have to be extra careful. And I think we must tell our patients' parents also that if you have any doubt in the understanding of the dosage and duration, please call us again and get it clarified. That is very important. That's what I feel. And I'm very thankful to Dinesh, Mittal and Shalini for a wonderful meeting. Thank you.
Thank you, sir. Dr. Gupta, it was really wonderful presentation. And from pediatric cardiologist view, the use of electrocardiogram in a patient who is having some kind of poisoning, because QTC interval is one thing which may be like prolonged in acquired way because of drugs. And sometimes it's hidden and still you get overt prolonged QTC interval in certain cases. So electrocardiogram remains a really very important thing once we are dealing with a patient with the and I think antihistaminics may also cause that besides the psychotropic drug. So sir, it was really good enlightening lecture. And I'm just looking forward to another lecture on 28th of August. Thank you, Dr. Dinesh and Dr. Shalini. You both are so active and picking up all the right choices. Keep on doing that. Thank you very much.
Thank you, sir. Thank you, ma'am. Thank you, Gupta, sir.
I'll just close with the last comment, one comment, which is really important. हम सब यहाँ के इंडिया में है कि कोई चीज़ हम फेंकते नहीं हैं, स्टोर करते हैं, एंड दैट इज आल्सो रीज़न कि हम अपनी वाइफ भी जल्दी से चेंज नहीं करते, ठीक है, एंड दैट्स ए गुड, बट कीपिंग आवर ओल्ड थिंग्स इज नॉट ऑलवेज गुड एक्चुअली, पर्टिकुलरली रिगार्डिंग ड्रग। सब लोग कफ सिरप, पैरास्टामोल, ये दे कीप ऑन स्टोरिंग फॉर ईयर्स टुगेदर एक्चुअली। कफ सिरप खोल लिया, 2 महीने बाद भी वही दे रहे हैं, 6 महीने बाद भी वही दे रहे हैं, दे नहीं जी, एक्सपायरी डेट तो नहीं निकली। You have to tell them कि expiry date is only for sealed medicine. We have to stress this point to all the families actually. Expiry date is only for sealed medicines. Once you open them, use that during illness and discard it. Right? There are 2 reasons for this thing. Once you open them, all these are having sugar based. Contamination starts occurring in this medicine. Chances of contamination and getting less efficacy is there. Second, more medicine are lying at home, more chances of toxicity are there and accidental poison are there. So every time I always them कि एक्सपायरी, कहते हैं मिठाई का डब्बा आता है तुम्हारे घर के अंदर, खोल लेते हो, कितने दिन में खाते हो? 2 दिन में सर, महीने तक तो नहीं रखते ना, क्यों? ठीक है, आई कैन दिस एग्जांपल एंड दिस वर्क्स वेरी वेल। उनको समझ आता हाँ उसमें तो चीनी है, तो टेल देम। उससे तीसरा फायदा पता है क्या है? तीसरा फायदा है कि तुम्हारे प्रैक्टिस पे फर्क नहीं पड़ेगा, पुरानी दवाइयाँ नहीं देंगे।
Very practical tips, sir.
Thank you. Today I also learned many patients do ask about this thing कि मैम खोलने के कितने दिन तक रखनी है दवाई? एक्सपायरी डेट तक तो बोलते ही थे सर, बट अब थोड़ा और ध्यान रखेंगे।
तो है आई ड्रॉप्स एंड नेजल ड्रॉप 1 month।
यस सर, यस सर।
Better tell them कि आप use and discard it actually.
Use and discard, that is the best policy.
All medicines,
all medicine, use and discard it. Once you open it, use and discard.
Okay sir.
यार our pediatric medicine कितनी सस्ती होती है यार।
पैरासिटामोल वगैरह तो सस्ती है ही सर, बाकी तो फिर भी सोच सकते हैं। ठीक है सर, थैंक यू सो मच, it was very nice and comprehensive sir. Thank you so much.
Thank you sir. It's really my pleasure that you gave me a chance to interact with all my colleagues, and thank you Dr. Naab, Dr. Smita, Dr. Dinesh and Dr. Shalini. All of you are so good.
Thank you sir. On the 15th August from IAP North Delhi, we are celebrating the Independence Day, and all the dignitaries are invited for that. It will be on the June, and all the attendees also are invited. We are putting all the messages, and it will be a cultural program. We'll be singing and we'll be just celebrating that. So all of you are invited, sir.
Thank you. Thank you, sir.
Thank you.
With this, thank you very much.
Okay, can we close?